Cancer is the leading cause of death in the world, accounting for over 15% of all deaths. There are over 100 different types of cancer that plague people around the world. This disease is so well known and lowly regarded that it has become synonymous for words such as evil or bad.
So what is this infamous cancer and how does it work? What's the big deal? I'm only in high school.
Cancer refers to a broad group of diseases that involve abnormal cell growth. The cell cycle, the process by which cells progress and divide, lies at the heart of cancer. In normal cells, the cell cycle is controlled by a complex series of signaling pathways by which a cell grows, replicates its DNA, and divides. This process also includes mechanisms to ensure errors are corrected, and if not, the cells commit suicide, apoptosis. In cancer, as a result of genetic mutations, this regulatory process malfunctions, resulting in uncontrolled cell reproduction. The cell cycle is disturbed since cancerous cells do not go through interphase, which is when they do the job their body needs the cells to do. Instead, they multiply uncontrollably, while normal cells know when to stop. A cancer cell is formed when there is damage in the DNA and the cell starts reproducing and growing abnormally, leaving the reproduced cells also damaged. It avoids being replaced in the body and continues to produce damaged cells that in turn produce their own damaged cells. This then causes a tumor, which can spread to other parts of the body. A tumor is a mass of tissue usually made of damaged or dead cells. Cancer can start almost anywhere in the body. It's all it takes to start are dead or damaged cells that aren't being replaced with new healthy cells. The place where cancer begins is called the primary site. The process of metastasis is the spreading of cancer cells in order to metastasize. Cancer cells must break off from their primary source and travel to other parts of the body. The cells may spread through the bloodstream or through the lymphatic system, which removes bodily fluids and fights bacteria or cancerous cells. After moving through the bloodstream, the cancer cells move through the cell wall into the nearest organ. Most cells will not survive this process due to white blood cells or the immune system killing them off, or the fast rush of blood. Some cancerous cells may stick to platelets and form clumps for protection. However, this causes clotting in the blood. Platelets are blood cells that help stop bleeding. It is only used to clot the heavy flow of blood coming out of the body. The two types of tumors, malignant and benign, can be caused by these reasons, but benign cells aren't considered cancerous. Malignant tumors spread throughout the body and invade other tissue, causing the tumor to grow. They can also break off and spread to an entirely different area of the body, causing multiple tumors within the body. Benign tumors, however, do not spread to different areas of the body, and once cut off from the body, usually do not grow again.
That was a lot of information. Now I'm wondering what the effects on the body are.
Well, cancer cells aren't designed for specific functions like the normal cells of the body are. Proteins are created during interphase and are what allow your body to function and do its job. When a cell becomes cancerous, it doesn't go through interphase, so it cannot make proteins. This cell keeps reproducing and taking up space in the organ that it is located in, but it isn't functional. These cancerous cells can also void with signals the body sends out to stop the reproduction of cells. The cancer cells can actually influence the nearby cells in feeding the tumor with the cells, molecules, and blood vessels of the body, causing the body to become sick. Along with these abilities, cancer cells can avoid the immune system, often being able to hide from it. Cancer cells cause clotting in the blood, which causes weakness in muscle, severe pain, and gradual swelling in the limbs. There are many different types of cancer, one of the most prominent being lung cancer, which causes shortness of breath, chest pain, uncontrollable coughing, and weight loss.
Alright, now I know why cancer works and why it's so bad. But is there a way to prevent it? Why even people get cancer in the first place?
Genes that are inherited from biological parents cause some types of cancer. Mutations may be inherited from parents or caused by outside forces such as smoking, obesity, viruses, and lack of exercise. However, many other cases are preventable by changes in lifestyle, and an estimated 4 in 10 cases. These changes include not smoking, having a healthy body weight, drinking limited amounts of alcohol, a balanced diet, staying active, being safe in the sun, and avoiding jobs where there are a lot of chemicals in the air. However, even with these healthy habits, one may develop cancer, but the odds are much less likely.
Is there a type of cancer I should worry about the most? What kills the most people?
Now, like you asked, let's zero in on lung cancer. It's the number one type of cancer in the developing world, and it kills twice as many people as the next form of cancer. In 2015 alone, 221,000 new cases of lung cancer will arise. 158,040 deaths from lung cancer will also occur in this year alone. According to a study by the American Cancer Society, the probability of a man to develop lung cancer from birth to death is 7.4%, and for women it is 6.2%. This means 1 in 13 men has lung cancer and 1 in 16 women obtain it. However, these percentages are predominantly based on if a person exposes himself to certain risk factors. The most common risk factor for developing lung cancer is cigarette smoking. According to ALA, smoking causes 90% of lung cancer. Long-term smokers are mostly found in lower socioeconomic groups where people start smoking at an earlier age, says Action on Smoking and Health. The second most prominent factor is exposure to radon and other chemicals. This is shown by the fact that more than half of the people that worked in mines in Central Europe in the 19th century died of lung cancer because of the radioactivity. More developed countries are more prone to lung cancer due to the excessive amount of air pollution. According to the Washington Post, countries like Serbia, Russia, Hungary, and Greece have extremely high rates of cigarette smokers. One person annually smokes around 2,750 cigarettes. These countries are at higher risk for lung cancer due to the heavy exposure of cigarette smoke. Less developed countries are at lower risk for lung cancer since they are not as exposed to pollution or cigarette smoke. For example, the continent of Africa is at very low risk of getting lung cancer, so the best way to prevent lung cancer is not smoke and not expose yourself to dangerous chemicals.
So what? Me and my friends smoke all the time and I feel great. What even happens when one gets lung cancer? Can it be even treated?
It may not seem like a big deal to you now, but it is very dangerous. There are many ways to treat lung cancer once it is diagnosed. 42 out of 100,000 United States citizens are diagnosed with lung cancer every year, according to the Cancer Global Footprint. Other countries such as Poland, China, Hungary, and Serbia have high diagnostic rates. The earlier the cancer is found, the easier it is to treat. Surgery is used to get rid of cancer and when it is found in concentrated areas of the body and is also used as a way to diagnose it. A doctor removes all or part of the tumor to study, diagnose, find the stage your cancer is at, and hopefully remove all of the cancerous cells. This may result in pain, fatigue, swelling, or appetite loss. If that does not succeed, then chemotherapy and radiation are resorted to. However, lots of patients in lower class or more rural areas are much less likely to receive active treatment, specifically chemotherapy. Chemotherapy is commonly used to treat cancer. It slows the growth of cancer, reduces symptoms, and kills cancer cells. However, it often kills healthy cells as well, which also results in hair loss, vomiting, memory changes, fertility loss, and other symptoms as well. Radiation is the third most common treatment, which uses radiation to treat cancer. It stops the tumors from growing by killing the cancerous cells and may cure it. Appetite loss, fatigue, and skin changes are a common side effect along with the hefty price and radiation costs. There are many other treatments available, but these three are the most prominent. However, they do not always work and the side effects can be costly. The treatments are also pricey, with initial costs for treatment averaging to $60,533 and $60,885 for women and men, respectively, along with continual costs of around $8,000 per year. So, many people are not able to afford treatment and then die because of it. So, to summarize what we have learned, lung cancer is very dangerous. However, cancer is treatable and may even be preventable. Do not smoke or expose yourself to chemicals, and you are on your way to staying lung cancer free. Lifestyle choices like smoking starting even in high school can lead to cancer. Don't put yourself at risk.
Well, I sure won't be smoking anytime soon.